Nurses experience challenges with colleagues. It's interesting, we can be united and divided for the very same reasons. So, for example, a nurse in the emergency department wants to call report to the floor. The nurse on the floor wants to be prepared and create safe conditions for the admission. At times, there can be a discord as we attempt to transition patients from one level of care to another. Yet we all are doing our jobs for one reason, for the same reason, for the good of the patient. Another challenge nurses experience is dissatisfying work conditions, whether it be staffing numbers, adequate pay, workplace violence. Sometimes the very job we find ourselves in sets us up for unhappiness. Let's say you're a brand new nurse to a certain unit or group. You know it's good for you, even necessary, to take a lunch break, to take care of yourself during your shift. But the nurses who have been on this particular unit for years make it hard for you to leave. Telling you things like, "It's our culture to skip lunch here. You're going to go off the unit? Yeah, right, try it." And we feel sort of bullied into staying. A final example of a challenge a nurse may face, as there are many more, I'm sure, is that we just don't have time for our patients these days. Have you ever had a patient peek around the computer screen, look at you and say, "I'm right here"? These days, in the world of technology, which is wonderful and necessary, we have distracting phones, constant alarms, the feeling of overwhelm with this continuous and never-ending documentation. How can we have time to be with our patients when we feel as though we're connected to computers all day? You know, we go into the profession of nursing for a reason. In my hundreds of interviews with nurses on why they chose nursing in the first place, I hear it a lot. Stories like, I was injured as a child, and the first face I saw was that of the nurse. I knew right then and there what I wanted to be when I grew up. I wanted to be just like her. Or another example I hear often is those folks who are interested in science, saying that they loved science in school, but they also felt that caring, that sense of empathy. And the perfect job for them was nursing. They could study the science of medicine, but still get to interact with the people. We enter nursing to take care of patients, to really provide safe, quality, effective care, to sort of be that shoulder that a husband may need to cry upon, to be the one to explain things in plain language, after the providers leave the room. Nurses are really there through it all. We provide healing, offer teaching, and just take good care. We do it for one reason and one reason alone: to simply help people feel better. What can we do about this then? As nurses, we're too busy at times to spend quality time with our patients. We find ourselves in jobs and workplaces that offer less than ideal conditions. How can we enjoy nursing again? How can we reconnect to the patient, to the passion for our profession? How can we remember and re-engage with that nurse within? So on this slide, you'll see 3 things you can do to ignite that spark inside of you. And we're going to go through each of them one by one on the following slides. So first off, increase your capacity for presence.
Some practical tips that you may try in your workday are, first off, pausing before you enter a patient's room. Before you go in to assess, before you go in to give medication, before you go in to answer a question, can you pause and just take a breath in and out through the nose before you enter the room? Just feeling the ground beneath you, feeling your physical body, the scrubs up against your skin, and just taking that breath in and out through the nose. It will take 5 seconds to do this. A second practical tip is as you wash your hands. And so not the Purell or hand sanitizer on the wall, but as you literally stand at a sink washing your hands, doing as we are taught, washing the fronts, the backs, the sides, underneath the nails, all around the hands, can you recite a mantra? I choose to feel present in my nursing practice. I choose to be mindful of the patients I care for today. Just something over and over as you're washing your hands instead of running through your laundry list of things to do. And the third idea is making eye contact with each and every person you speak to. Now, if this is culturally acceptable, of course, but making eye contact. Instead of fiddling with the IV line or looking at the computer as you're talking to the patient, really choosing to be conscious of making that eye contact, looking at the person, speaking to them by name. So those are just 3 simple things you can do to increase your capacity for presence, which will help you feel less rushed and overwhelmed throughout your day. Second strategy is to look at our thoughts, feelings, and language, because it is a true and studied fact that what we think about influences how we feel, and then those emotions that we feel influence how we behave and act. So I just want to ask a question and sort of give you some suggestions here. So the first notion is being aware, paying attention to how many times throughout your day do you use the word don't, okay? Focused on what you don't have. We don't have enough supplies. We don't have enough staff. We don't have money for the conference. We don't have time for our patients. We don't have. So the more that you say these don'ts, that is what we're focused on. That is what we pay attention to. That is what we give strength and energy to. And that is then, in fact, what we get more of. So how can you flip that? I am well aware that many of these challenges are in existence. I have been through and experienced them myself, so I'm not downplaying the severity of the situation. But instead of looking at what you don't have, can you focus on what you do have in front of you in terms of resources or opportunity or creativity or great personnel, or what do you have, and then focus on those solutions. Secondly, we can use our commute into work. So whether you're driving, walking to work, biking, taking a subway or bus, just focus on what you are thinking about. Are you worried about the upcoming shift? Are you feeling irritated that you have to go in for extra time? Are you feeling resentful of your colleagues who, you perceive as not working as hard as you, that sort of thing. So be mindful of your thoughts as you're commuting into the workplace. Use that time to fill up with growth, with positivity, with opportunity, with solution. I use my commute to work to listen to spiritual teachers, to listen to business coaches, to listen to podcasts on nursing empowerment and topics that are uplifting. So use your commute into and out of work to serve you instead of bringing you down. Okay. And final suggestion, the tip to help us reconnect and spark that energy of nursing within ourselves, is to bring ourselves into our role. And a few practical things you can do here is, first off, laugh at yourself. Now, I'm not saying we need to laugh at ourselves we are professionals. We're not downplaying the profession of nursing. We certainly want to appear as a profession, okay? What I'm saying is, don't take yourself so seriously. So If you spill something on your scrubs, or if you realize you mismatched your socks, if you stepped in some sort of bodily fluid that was spilled on the floor, instead of saying, gosh, look at what a screw up you are, instead of judging or criticizing yourself, play with yourself, laugh with yourself, have fun at work. Secondly, bringing hobbies into the workplace. I read a blog several years back about a male nurse who worked in long-term care, and the residents would come out into the hall because he would sing. He would sing and hum to himself, and he had the most beautiful voice. And as he was preparing his medications, or as he was walking the halls and doing room checks, he would hum, he would sing. This is something he enjoyed. This is something he was good at. He brought himself into the workplace. Bring hobbies, bring your stories, bring your traits and your personality into the workplace. Another idea here is to play with your colleagues. So I talked about laughing at yourself and having fun with yourself, but play with your colleagues. And what I mean by this is, outside of work, try not to talk about work. So if you're going out to a dinner with colleagues, sure, you get around the table and the first thing you want to do is start venting and complaining about all the things wrong with the workplace. I have done that myself. I am well aware that happens. It's okay. But what I would suggest is set a timer. So maybe you do that for 5 minutes when you first sit down at the table, and then the timer goes off and the bell rings, and now it's time to shift the conversation to things non-work related. Get to know each other. Which leads me to the fourth practical tip here, is getting to know each other in and out of the workplace. So you might try, before each staff meeting, asking what you're celebrating in your life outside of work. Before you sit down at a committee or council meeting, going around the table and speaking about what you're grateful for and how it makes you feel. Or just anytime you interact with a colleague, maybe at shift report, just touching base with what's new, what's good, what's going on. Get to know each other and have fun.
Sure, nursing certainly is a scientific job. We are professionals who provide exceptional care based on the evidence. There's no doubt that we need the technology, that medical equipment, the scientific literature to practice our career. However, can we enjoy nursing just a little bit more when we allow some of the art to enter our practice? Bridging the art with the science of nursing allows us to feel the heart of our careers, lets us really reconnect with that nurse within. Bridging the art and science, I would say, allows us to be the very best nurse that we can be.